Welcome to Empowering Plans, a show dedicated to identifying waste and undue expense in the health benefits industry, discovering ways to maximize benefits while minimizing costs, and empowering employers, administrators, and consultants to emphasize once again the benefit in benefit plan. Today's episode is brought to you by Nova Healthcare Administrators, providing clients and unique reimbursement pricing arrangements, customized strategies, and personalized service. Now here are your hosts, the FIA Group's CEO, Adam Russo, and Vice President and Counsel, Jennifer McCormick.
Hello, everybody, and welcome to another episode of Empowering Plans with the FIA Group. I am your co-host, Adam Russo. With me, wait a second there. I almost said it. I almost said with me, as always, say hello, Ron, and Ron's not here. So, folks, there is no Ron today. But wait, Brady. Brady's not here either. So, you might be wondering, why is Brady not here? Why is Ron not here? Folks, I know it's not live, but this is the Friday before Labor Day weekend. I'm the CEO. I think I'm the only person here. Well, actually, I'm wrong. Our producer, Pat Santos, is here. Say hello, Pat. Pat just waved. The best possible co-host I can have. It's football season. This person is not our third stringer. This person should be the starting podcast co-host. But for political reasons, I am not allowed to, allow her to do all the podcasts. It might offend Ron. It might make Brady upset. I don't want Brady to move back to Washington, D.C. But with us, our very special guest is Jen McCormick. Say hello, Jen.
Hello.
She never just follows a script. She can't just say hello, Jen. I don't know why she won't do it, but it's a little ridiculous. So, folks, it is football season. It is back to school season. My kids at least start school next week. I know in many parts of the country, the kids are already back in school. But I just returned from Texas. So I spent 3 days in Dallas. And it's amazing to me how much they care about high school football. It's, I think, a little insane.
Yeah, it's pretty serious business down there. So
Friday night football starts tonight all over Texas. And the crazy story I heard is that there is a town there, I believe, McKinney. I'm not positive about the spelling of the town. So don't text me or email me or send LinkedIn messages saying that I messed up the name of the Texas town. But this town just built a brand new 10,000-seat stadium for high school football at the cost of $70 million. Now, there's no books there. They don't have any instruments for the band, but they're going to have a really nice stadium and nice lights. I mean, what do you think about that, Jen? You think that's okay?
You know what? Coming from Indiana, it's not necessarily the same as it was in Texas, but football is definitely a big deal down there, and people need something to do on Friday nights.
Wait a second. So, now Jen is putting down all of our listeners. She's telling us that these people, unlike Jen, the sophisticated, downtown living Jen that gets to go to all these beautiful restaurants and bars, most people across the country have nothing to do on a Friday night. So sitting in a bleacher to watch a high school football game is as good as it's gonna get for them. So yeah, let them spend the money. Jen, you can't say that.
No, that's something
exactly what you just said.
That was part of my childhood. We spent every Friday night at the football field, and it was always every little boy wanted to be on the football team, and every girl wanted to be a cheerleader so they could be there on the field and have the whole town watch.
So I just remember my high school football team. I was a star, as you would expect. But our cheerleaders, I don't even think watched. They were all smoking cigarettes behind the bleachers. I mean, it was a very different world, I think, when I played high school football back in the early 90s. Yes, I'm aging myself, Jen. Anyways, today we have a very special guest. It's not always possible for us to get guests that I just love, okay? I've been hoping that we would get this woman on our podcast for a long time now. She's always said no. She's never wanted to do it. I think she might have been a little afraid. I don't know why she'd be afraid to be on a podcast with us. We're so fun and nice. But with us for the first time is Laura Hirsch from Nova Healthcare Administrators. Say hello, Laura.
Hello, Laura.
Thank you.
I have been waiting to do that, and Ron isn't even part of it today. I'm so disappointed.
You can write an email to Ron expressing your disappointment, but trust me, we have a big upgrade with Jen here. Trust me. I mean, she already got, we're going to have threatening emails and letters from people in Texas within a couple days from now. So anyways, folks, Laura is the president of Nova Healthcare Administrators in the Buffalo, New York area, which is Buffalo and Niagara Falls, around that area. And she's been in that position since June of 2012. She's just an amazing person. She's so good at her job. She so understands the industry that I personally asked her to be on my company, on the FIA Group's advisory board, just because I just feel like I always learn something when I talk to her, and I just have a big crush on her. So I just want to say welcome, Laura, for joining us on this podcast.
That was supposed to be our little secret. You're correct.
There's like 5 followers. You'll be fine. Don't worry. No one's going to know. It's still our secret. But no, honestly, just want to thank you so much. Obviously, Nova and the fine people they have there have been working with FIA for many years now. We're excited about the growth of our relationship, but we're really excited about having Laura on today's podcast. And I guess, Jen, we'll just get right to it. What do you think?
Sounds good.
So my first question, if you wouldn't mind, is more of a personal story. So a couple weeks ago, I saw a picture you sent me with your son and yourself at the Cleveland Indians baseball game. So everyone knows how much I love the Tribe. So are you Tribe fans, or you just happen to be in Cleveland and just happen to go to a game?
No, I didn't just happen to be in Cleveland. So I wanted to take my son on a mother-son date. He plays baseball, loves baseball, and as everyone knows, Buffalo does not have a major league baseball team. And Cleveland is about 3.5 hours down the 90. So I got the tickets for him. I'm like 4 rows from the field and started heading to Cleveland. He did not know. So he's 13, started driving to Cleveland. So we kind of guessed the direction we were going. And I don't know if you realized it or not, but the Bills were actually playing the Browns that same night.
Wow.
I mean, those amazing Bills. And I mean, that's a game that everyone wants to see, the Bills and the Browns. I wonder which team's going to win a game first. That's my big question. Is it going to be November, you think, or will it be the first week of the season? I'm hoping it's the first week, but we'll see.
I think the Bills actually beat the Browns that night, if I'm not mistaken.
It's practice. It's preseason. It's like, as Allen Iverson said, it's practice. It doesn't matter, okay? I'll talk about the regular season. Anyways.
So all the way there, he thought we were going to the Bills game. And when he found out that we were actually going to the Indians game, he was so happy, so excited. So we had a great time. The Cleveland fans were amazing. He actually he caught a ball. So it was awesome.
Wow.
Oh, wow, huh? I caught a ball, too.
Yeah.
I had a very special moment last week. I got to take 4 of my kids to their first Indians game at Fenway, because I live here. Obviously, people know I live here in Boston. And we got to go on the field at Fenway before the game, which was pretty cool. So, awesome. See this? Not only is Laura just an amazing person, smart, innovative, she takes her son to Cleveland Indians baseball games. I mean, how do you beat that, Jen?
No, I don't think you can.
Exactly. Other than maybe Friday night football tickets for some random high school in the middle of nowhere. Perfect.
So can I comment on the McKinney High School football field?
Yes, please.
It's kind of funny that you brought that up, because my brother and his 4 children live in McKinney. And Interesting that you said that the band doesn't have any instruments, because I just got an email the other day. My nephew plays the trumpet, and it was an email asking to donate money to the band so that they can, they can have instruments and they could travel.
I mean, this podcast, we're obviously we're not talking healthcare right now, but it's exactly right. A $70 million football field, and the band is asking for dollar donations for equipment.
Yep.
Well, maybe they'll charge some sort of admission for the games, and they can give some of the money to the band.
I'm sure all the money goes to the starting quarterback's family in the form of booster money. Anyways, Laura, thank you so much for joining us. My first question, and it's pretty simple. I mean, you've been running a TPA. You understand the ins and outs of our industry. What is right now the biggest positive or negative thing that you're seeing across your line of business that basically is affecting your company, whether it's good or bad? Is there any insight in that you can share with us?
So I think from a positive standpoint, we are seeing a lot of innovative ideas or solutions being brought to the table by various entities, other like startup organizations, like direct primary care as an example. That's not brand new, but I think that there are so many innovative ideas that everybody's bringing to the table to try to, combat trends. And as a TPA, we are flexible, we're nimble. And I mean, not we as a Nova, we in general, as all TPAs across the country, that's our mindset, is to be creative, to offer solutions, and to figure out how to get things done. So I think, as a TPA, we have a lot of opportunity out there to support some of these innovative ideas and, really help bring about positive solutions for the self-funded industry.
That's great. Yeah, and talking about those different types of innovative ideas, one of the things that we've been seeing here that I'm curious about how or if this actually has impacted you is some of these specialty drugs or the prescription assistance programs that are being offered and available for individuals to participate in? Is that something that you have seen groups bringing to you or questioning or needing some assistance in trying to maybe work with the PBMs to implement types of those programs?
We have. And that's, I mean, we all know that that's one of the biggest areas that's, from a rising cost standpoint, it's on the pharmacy side. So we do work with, we actually have a sister company that has some copay assistance programs. And really, I think the key is to constantly keep an eye on what are the rebates or the pharmacy programs that are available. And you have to constantly be changing the formulary so that you can keep up with it and take advantage of those programs on behalf of the member and the self-funded plan.
So do you have people internally that are trying to keep up with those formulary changes? I mean, how do you do that?
So we do rely on our sister company. They are constantly watching. We actually, for some of our clients, have a fourth tier. It's a fourth tier formulary that we put in place, and it changes. It's changing on an ongoing basis, and our care navigators are working with the members that are on those prescriptions so that to help them understand that although it may appear to be a fourth tier, that with the copay reimbursement programs from the pharmaceutical companies, that it's really not going to negatively impact them. So it's a combination of individuals monitoring what's going on, implementing the programs to best, meet the needs of the members and the clients, and our care navigators supporting the members through those changes.
So switching gears for a second, I want to talk about an issue that we have seen grow tremendously here at the FIA Group, and it's in regards to stop-loss disputes. Now, obviously, not all carriers are the same, not all MGUs are the same. I guess there's been a definite trend of cost increases. Healthcare costs are continuing to rise, and I think stop-loss carriers have a duty in some situations, obviously, to audit claims, to see if, plans and TPAs are being prudent with how they're spending their money. But what we're noticing in many of the policies now are vague provisions, real gaps, and the number of either claim denials for reimbursement or claim delays for reimbursement has definitely grown. We've seen it grow across the country, regardless of the size of the TPA. Is that something that you've been noticing as well? And is that something that concerns you, not only for your organization, but just self-insurance with TPAs overall?
So I would say yes. Recently, we have started to see, I think it's more on the delay, where they're taking more time to really analyze the claim submission to make sure that it is appropriate. So we have been seeing some delays in reimbursement. But I do think that, that one of the reasons that we partner with FIA, and this is not meant to be a plug or a sales.
Oh, feel free to plug. It's fine. We love plugs. We love it.
But
it's not a problem.
But we're relying on our relationship with FIA to really help us make sure that there are no gaps between the stop loss policy and the plan documents, to make sure that our clients are protected.
My follow-up on that would be this. Is it putting more of a strain on your employer clients and your relationships with them when these delays occur? I'm assuming they're calling you constantly saying, hey, what's going on with that claim? Are the delays causing more pressure on you and your organization to try to appease your clients and, keep them happy?
So did you have a bug in one of our conference rooms the other day and hear the calls that were going on between our client service and one of our clients?
I actually did, yes. I did have a bug.
We have a situation right now where, unfortunately, it is an aggregate hit, and we are getting some pushback from the stop-loss carrier, and our client's frustrated because they've been expecting their reimbursement and they're not getting it, and we're, fighting on their behalf and going back and forth, and it's because the client doesn't really have the direct relationship with the stop loss carrier. We are caught in the middle and have to advocate on their behalf. So yeah, it's a real situation that is occurring right now in our office.
As an advocate of self-funding, obviously you all know that that's my passion. I see this as a growing issue regardless of what TPA you're with, because in the ASO world, they use the fact that it's all bundled in one. Stop loss is there. If the plan pays the claim, the stop loss carrier will reimburse. It's all nice, one happy package, regardless of the fact that it's so much more expensive. But yet they use that as part of their marketing campaign as to why people should work with an ASO rather than a TPA. So we're hoping that more and more TPAs and brokers can get educated so they can actually work with good carriers, or even if they see a policy that doesn't have the best provisions in it, at least they know about them ahead of time so they don't put themselves in these particular situations. Jen, anything to add?
Yeah, so and kind of talking about that from a stop-loss perspective and claims not necessarily being reimbursed and groups being unhappy, the other type of trend that I have been starting to see for whatever reason, it used to be a trend a few years ago, and I'm talking about DOL audits. So a couple of years ago, I was aware of quite a few audits that had been going on. Groups had been pulled to get their documents, all their materials, their notices, so the DOL could investigate. And some of them seemed like they were random and not necessarily as a result of a complaint. But for whatever reason, in just the past couple of months, I've actually heard of a couple of individuals, a couple of groups who are actually being audited again. And I know Brady's not here, so I'm not talking about the politics behind it, but
We know he would.
it was always my impression that the DOL was going to be taking sort of a step back when it comes to doing some of these audits because there were other priorities, maybe releasing some wellness rules about whether or not you can offer an incentive or reward someone for a wellness program. There are other things on the agenda that I thought were more important. So it was a surprise to me to hear that DOL is actually paying attention and starting to do some of these audits. Have you seen any action from the DOL? Any of your groups been audited recently, or is this just something that hopefully is random?
So actually, so Nova is owned by a local health plan in Buffalo in the Western New York area. And I would say 9 months ago, maybe 9 to 10 months ago, we did get a DOL audit that they were auditing the parent company and all of the self-funded plans that they offer locally. And because we are a wholly owned subsidiary of the health plan, it included our self-funded groups as well. So it wasn't group specific. It was our entire book of business.
Wow.
We had to provide data. They came in, they randomly selected, different pieces of information that they wanted to audit. So we were selected as part of a random audit of our business.
Well, then hopefully you're in the clear for a little bit.
Yeah, hopefully there's more random ones done, but not anywhere near you. That's the key.
Right, exactly.
Hey, Laura, we truly appreciate the time you've given us today. I think we've all learned a lot. I think our listeners have learned a lot as well. So I want to thank you very much for joining us. Folks, again, Laura Hirsch, the president of Nova Healthcare Administrators. We're lucky enough to have Laura join us today here on our podcast. Laura, thank you so much.
All right, thank you. It was an honor.
Folks, just want to remind everybody, we have our new introduction video on FIA's website. Go to our website, click on the Welcome Video tab, and under the About Us tab, you'll see the video there. I know we had a lot of people spend a lot of time working on this video, so if any comments, insight you want to give us, please feel free to reach out to either Jen or myself. That'd be great. So, on behalf of Pat Santos, our amazing producer, the third stringer, Jen McCormick, and the McKinney Marching Band, we're going to set up a GoFundMe page for you guys. I am your host, Adam Russo. Thank you so much for joining us today on Empowering Plans with the FIA Group. Have a great day.